Some of the aides working in the office of the Chief of Staff of the President have revealed they are living in fear ever since their principal, Abba Kyari, tested positive for the coronavirus. Of course, you know the pattern, the modus operandi of these supposed leaders, but they are actually rulers. They are going to take priority when it comes to healthcare, since it is difficult for them to travel out of Nigeria to seek for medical aid. Now, the chief of staff reportedly tested positive to the dreaded disease, and he had gone for self-isolation, afterwards quarantined. It was reported that some staff in his office had direct contact with him, and they also tested positive. However, majority of the staff in his office who also went into self-isolation in compliance with the directives of the Nigerian Center for Disease Control, NCDC, have claimed that they are still waiting to be tested for COVID-19 pandemic. Vanguard newspaper reported some of them are saying they are now living in fear as the NCDC has not reached out to them for a test. A source in the presidency, and specifically the chief of staff office, said, "We are now in God's hands. Some of us have even volunteered to be tested, but the NCDC is saying that it is only when one manifests the symptoms that they will test them. It is only God that will help us, including you, the journalists that cover the State House. Maybe what they are saying is that if anyone has the virus, let the person die. And this has brought a lot of fear everywhere. Even people have started to be afraid of the test kits because of the kind of information out there that the kits for the test are infected already with the virus. This has even made it impossible for people to go out again for a test. No one trusts. The only consolation we have now is that the whole office has been fumigated, and that settles that part of it. Now, about the test kit that has been infected, the United Kingdom was the first to come up with this. They said a company in Luxembourg, a laboratory in Luxembourg that produces all of these test kit, both primers and the rest of that, they said that the test kit tested positive to coronavirus. Now, we don't know if this was a deliberate action or this was an accident. You know, many of the people that are involved in the production of this test kits are humans too, and they might also have the virus. Probably they are in the first stage of the virus. We don't know. It could be just anything. It could be anything that must have happened there. But United Kingdom had to first test the kit, check some of the batches, and they said that there's no problem, that it can be washed, probably with some other, with alcohol or whatever it is, antiviral, whatever it is. You know, the virus becomes tough when it gets into the body of the human. When it is in your throat, they said if you take hot water with vinegar and salt and stuff like that, you might be able to get rid of it. But when it begins to embed itself inside of you, then that's when it becomes complex and complicated. But when the virus is outside, like on the primers and the test kits, they said that it can be watched. But then who is going to depend and believe that a test kit that is already infected with coronavirus and it has been watched, it's not even reinfected again? So it's a complex thing out there. And about Abba Kyari's staff that are already complaining, and about the journalists that also cover the State House, it is a terrible time that we live in. Like I said, these people will have the highest priority when it comes to medical treatment in Nigeria. And the ordinary masses or the staff that are attached to any of their offices are nobody. They will put themselves in the best facility available in Nigeria. Yeah, there are hundreds of beds, 1,000 bed I've seen in FCT Abuja, in one of the isolation center. They have in Lagos State, they have in several places, but the isolation center is not everywhere. as they are looking, it's like a focus, they are looking at how much they can contain this virus and how much it might spread. There are also indications out there that there are a lot of people that might be infected with this virus, and because test is not so easily available, it's not just in Nigeria, it's in the United States of America too. They are having issues with test. In fact, a Nigerian passed away because no one came to test him. So we shouldn't believe that this is a strange this pandemic. I mean, in this present generation, is strange. A lot of people have not experienced this at all in their life. Yes, they had MERS. They had it's more or less like a strain or a variation of SARS. SARS is simply severe acute respiratory disease virus that infects the respiratory system. But this is a pandemic that spread so fast. I mean, the speed at which this virus spread is it's astronomical. And now they said this virus is man-made. It actually must have come from a laboratory in Wuhan, China, where this the first case of this virus came up. So they said somehow the virus escaped. How did it escape? Probably someone was infected, probably trying to do one or two things there, or they intentionally brought it out from there. I wouldn't know, but I don't think it's smart if there is a laboratory in that same region and they decide to infect from Wuhan. Maybe they would have done that elsewhere in China if it's a deliberate one. But then we don't know how these people think anyway. But I'm thinking it's an accident, a virus that they're actually testing to see the strength and the but I'm wondering, why are they actually testing or creating or inventing a virus? What are they actually doing? What is happening in the virology laboratory there? What do? Do they come up with different strains of virus to attack people, or they come up with this virus and see if they have vaccines that will kill that virus? Then what's the purpose of creating something new? Are they thinking ahead? Are we going to call this being proactive? Bringing up a virus and imagining that virus could infect people. What is actually behind this? These are questions that a lot of people want to know. So back to Nigeria, like I said, most of the challenges in Nigeria is the issue of government coming up with palliative assistance to at least cushion the effect of this lockdown that is ongoing in some states. It's in FCT, Abuja. You find that in Lagos State and some other states where they have high numbers of people that are infected. Lagos State is doing a very good job at the moment, but then they still have a lot more to do. There should be more organization, as I have seen that there aren't much organization. They've tried, they've gotten some details, and they sent certain people some text messages. But what about the sharing of the food? If they are going to keep social distance, how are they going to bring the food home to the people? And what about infection? So we are talking about infection. These people are going to move around. So it's a terrible thing. It's a complex thing. This is a strange thing that is happening now here in Nigeria, and of course globally. A lot of things are happening. Some people are reinfecting themselves using even the face mask that you touch every time. So it's a terrible thing. Some people even make use of gloves and they put it on all through the day, which is wrong. These are terrible times that we are living in. A lot of people have been miseducated, and now that they are even talking about test kits that are infected already, a lot of fears are out there. Now Nigeria got loads of test kits all the way from China, from the CEO, the owner of Alibaba, Jack Ma, and I don't know if they even thought about testing it, or they just put it on and they started making use of this test kit and reinfected people. These are trying times. I expected that this test kit should go through vigorous examination so that they would not now infect people that are not sick. Imagine people that are not sick but feel that they've been in contact with someone that came from Europe, or someone that has the virus, or from someone from China, and they go in there and they eventually get that infection, not because they have it already. So we are in a very troubling time at the moment. So what is now the issue of people that must have gotten a virus from chief of staff or from any of the politicians? Why are they not giving the actual treatment? Why are they not actually looked after? Yes, I heard that the virus, if you are infected with this virus, you need to show symptoms before you can be tested. Like if you don't show symptoms, you might not necessarily. But that I don't think that's the truth. The governor of your state Markinde, he said he's asymptomatic at the moment. He is not showing signs of, there is no symptom being shown, even though he tested positive already. Why has he been tested? Because he's the governor. He had what they call priority. He was quickly tested and they came up with the result, even though there are no symptoms. He's not sick. He has only self-isolated himself. So I believe that there are people that are already infected with this virus that will test positive to this virus, but they have not been tested. So it's very important that they are tested. But then what about the equipment, the test kits that they claim some of them might have been infected? So I think the NCDC need to do more. The Nigerian Center for Disease Control, the quality control section there, they need to do more so people will believe in them. That's what it is for now. If you're not a member of this channel, we can grow together by you tapping on the subscription button and the red notification icon bell below. It will alert you whenever our videos are uploaded. Thanks for stopping by.